Okay, good morning, everybody. Welcome to the Environmental Health webinar for July 2024. Before we start, we'd like to acknowledge the Whadjuk Noongar people as the traditional owners of the land where we are meeting on today, and we pay our respects to elders past and present. With me today in the office here, we have Catherine Lin from OzFoodNet. And also online we have Alison Brown. So she is the Master of Epidemiology Scholar for Australian National University, and she has been the lead investigator from CDCD and OzFoodNet with this foodborne outbreak case study that we'll be sharing with you today. So both Alison and I will be sharing on the foodborne illness outbreak investigation with this recent outbreak as a case study. Then later on, Danny Gold and Avi Das will jump on. You'll see them later on camera, and they will be sharing on meat safety auditing. And we'll end off today with Rebecca Delsa from Food Unit as well, and she'll be sharing with everyone the update on the WA Food Business Risk Profiling Guide. Okay, so we have turned the chat functions off because we do have quite a few participants today, but feel free to comment or throw your questions via the Q&A function. So click on that icon there on your top bar. Once you've posted your question, I've got my colleagues here, Danny and Avi, who review the questions, and then we will post it live, and we'll try to get to it by the end of each presentation. So now I'll hand over to Alison, and she'll be sharing on foodborne outbreak investigations with this recent outbreak as a case study. So over to you, Alison.
Thanks, Henry. Okay, I'll just share my screen. We can start. There we go. All right. Okay. Yeah, thank you, Henry, and thanks everyone for joining in. So yes, as Henry mentioned, I'm Alison, and I'm a Master of Applied Epidemiology student that started a few months ago in the Communicable Disease Control Directorate at Department of Health in WA. And I was, I think it was generous of Henry I was leading this investigation, but I think I was part of a team that was in the investigation, but really with Stacey Hong and Barry Coombs. We did the epidemiological side of the outbreak that happened a few months ago. I'll also do an acknowledgement of country. I'm coming to you from Europe today, but for many of you, you might be in southern WA, and that's where this work was done as well. So that's the land of the Whadjuk people of the Noongar Nation, who are the traditional custodians, and we'll pay our respects to elders past and present. So Henry asked me to present on the public health and epidemiological side of an investigation that goes into a foodborne outbreak, to show what we do and how that complements many of the field and frontline work that the rest of you do out there in the real world. So really trying to understand the role of the Department of Health and a bit of what the laboratory does in a foodborne outbreak, and mostly using a case study. I only have 20 minutes, so I won't try and cover everything, but instead try and bring together key points from that case study from our point of view. So I guess, as you probably all know, outbreak investigation and response is a team sport. So I'll just be mostly discussing what our part of the team does. Okay, so who is OzFoodNet, which is where we're based and where Kat is running the show at the moment. So OzFoodNet is a network of epidemiologists placed within each state and territory health department, and with also a national representation. In WA, they sit within the Communicable Disease Control Directorate, and it's normally a role covered by 2 epidemiologists. And really their goal is to reduce cases of food-related illness by investigating and responding to foodborne diseases, but also providing information with their range of stakeholders and partners to prevent and respond to foodborne risk and all enteric diseases. Thought a good way to frame how a foodborne outbreak is responded to is to use the 10 steps of an outbreak investigation, which is an epidemiological concept, and you'll find different descriptions of them depending what source you use, but this is one of them. I think it's important to know that different people will do different parts of the outbreak investigation, so I have different members of those teams. Also that these are not in a time step order, but can happen concurrently, and we can skip steps and go back to them, but really there to remind us that we do need to consider all of these 10 steps when investigating and responding to an outbreak, particularly a foodborne outbreak. So, a case. We're going to talk about an outbreak of Salmonella typhimurium that was linked to banh mi. So, number 1, determining the existence of an outbreak. So how did this happen? People started getting sick with their gastro symptoms. People did a couple of things. First thing that people did, this isn't real Google reviews, but people took to social media to talk about their complaints of illness. People went to hospitals and emergency departments, and people also phoned the food venue directly and their local government to say that, look, we are sick, and had complaints. The hospitals took stool samples from some of those sick patients, and we have a range of private and public pathology companies that process those samples and identified that a number of people were getting sick. And both the private hospitals, public hospitals, pathology companies and environmental health officers at the local government informed various parts of Department of Health, including Borloo Public Health Unit, previously known as North Metro Public Health Unit, Henry's team Environmental Health Directorate, who informed us here at AusFoodNet, and CDCD. So there was a number of cases. So firstly, I think we found about 8 to 10 in the first week. So we noticed it was a cluster, but is it an outbreak or is it a cluster? I'm sure you mostly know the difference, but just to remind you, because I only learnt this recently. So a cluster is defined when there's a number of cases of disease in excess of what would be expected, as we could be seen by the number of hospital presentations and phone calls. An outbreak is a type of cluster, but when those cases all have an epidemiological link, so people were linked to one another or had attended the same venue. So I think for this one, we could say, yes, we had an outbreak to investigate. So confirming the diagnosis. We had a diagnosis of gastroenteritis. People were sick with bloody diarrhea, dehydration, vomiting, fever, abdominal pains. Laboratory can quite quickly tell us from stool samples that it was a Salmonella, which is a compatible illness with that gastroenteritis. I thought we could just revise a bit of the microbiology of Salmonella. So just clarifying, we're talking about non-typhoidal Salmonella species, which is a very common cause of gastroenteritis in Australia and a cause of foodborne outbreaks. Most cases of illness in Australia are caused by foodborne contamination, although it can occur from person to person transmission as well. As you can see, there's got optimal growth conditions and kill steps, and has an incubation period normally of about 2 days, but it can be up to 7 days. What does the laboratory do when it gets a stool sample? First step they do is PCR, and they'll do PCR on a range of common enteric pathogens, and that's because it's quite a quick process and can give a diagnosis. They'll also do a culture. The benefit of a culture is they then have a sample for which they can do more processing on, but that does take up to 48 hours. You can see the gram-negative rods there of what a Salmonella culture would look like. If a sample comes back positive for Salmonella, the lab and Pathwest would do what's called a serotype. Serotype is based on these antigens on the outside of a salmonella, and that helps give it a particular type. There's about 10 types that cause most diseases in WA, most outbreaks. And of those, Salmonella typhimurium is the most common serotype that we've had here for the last 10 years, but other states might have enteriditis. The lab here then does something called a MLVA, or multiple locus variable number of tender repeat analysis. This is another step that's done on typhimurium and enteritidis types of Salmonella. This is something that's not done in every state, but done here in WA. Other states might jump to whole genome sequencing first, but here it's a step done in WA. Gives a genetic fingerprint of that sample of Salmonella typhimurium, gives it a 10-digit number, which allows it to be linked to other samples of Salmonella typhimurium. And you'll see how that's quite useful in investigating an outbreak. So what did we have? In this case, yes, we had a gastroenteritis. We had a compatible pathogen of Salmonella typhimurium, and the lab gave us 3 very closely linked MLVA types. Actually, all but 2 of them were one of those MLVA types. And this was quite useful because it corroborated the information that we had, that all the cases we were getting information on were linked to a single source. It also told us that who should be included in the investigation. So anyone who had a stool sample with this MLVA found in it, we could follow up to include in our investigation and see if they were linked to the outbreak. Later, it was useful because we could link the cases of illness to any environmental samples that were taken from the suspicious venue or items to see if they were responsible. So, defining and counting cases. A case definition is a fairly important epidemiological principle that defines who is in your investigation and who should be counted, and normally is something that has at least a time, place, and person component to it. In this case, our definition changed over time, but this was the final case definition we had. And as you can see, a confirmed case was someone who had the MLVA strain of interest in a stool specimen after the period of interest and had been exposed to the food venue. A probable case with someone who didn't have a diagnosis, noting that not everyone who becomes unwell after eating at a venue will see a doctor and get a sample taken, but they had the symptoms and had been exposed. The next step is to find and describe all the cases that we could. We found the cases via 4 different methods. So we had the emails initially from the laboratories and the hospitals and GPs with the names of people that were unwell with the illness. We also get surveillance, so we get the notable viable disease information here at the Department of Health through our somewhat archaic IT system called WANID, which means that the PathWest or other pathology companies can electronically send us information about important diagnoses such as Salmonella with an attached demographics of a case. We also had cases that were self-referred to the environmental health officers, and some people we talked to referred how other family members or colleagues had become unwell with the same illness, and we were able to get their consent to contact them as well. From that, we create a line list, which is just really an Excel spreadsheet with some columns and rows. Next, we have to do what's called descriptive epidemiology, which is describing the data in terms of that time, place, and person. So what defines this foodborne outbreak? And we do that by gathering as much information as we can from the cases. And that's Stacey and Barry and I talking to them all. The AusFoodNet has a range of questionnaires that we can use on patients by calling them up. This is the Salmonella one. It's quite a lengthy interview that we do. It's 11 pages and it covers a lot of the details around I guess, their illness, or what symptoms they had if they'd been travelling, and other maybe freshwater exposures, but particularly goes into a lot of detail around what they ate over their incubation period. Note that we commonly contact patients after that MLVA diagnosis. So it's normally taken a few days incubation period, and then they've seen a doctor after they've been unwell for a few days, done a sample, it's gone to the lab, maybe there's a weekend, there's several days for the culture to be done, and then the MLVA. So often we're contacting patients at least 2 weeks after their exposure to the culpable food item. So we are asking patients to remember what they ate over a 7-day incubation period. You can imagine some patients are better at answering all those questions than others, but we do what we can. And sometimes to improve recall, we do ask people to check bank transactions. Because of the case numbers in this case, we ended up contacting more than 170 people between the three of us. We did do maybe a bit of a shorter questionnaire that tried to target what we thought was a suspicious food venue, but without giving it away. And even if patients ask, we won't give any venue names away, but try and be broad and vague in our responses. So once we've done that, we can put all our information together in our line list and use Excel to create some nice graphs to get some more information. So firstly, we could determine when and what they ate. So we noted that of the first about 160 people, most people had eaten at this particular food venue, and most people had eaten a banh mi. As you can see, this is the dates that people ate there. So most people were eating around some particular dates there, and that's called an epicurve, and that's quite useful because it can inform the epidemiologist that it's most likely what's called a point source outbreak, and it's maybe going away. Something that had contaminated and grown to high pathogen levels is now going away. Interestingly, of the banh mi that were consumed, there was quite a range. The pork is the most popular food menu item at the place. So it wasn't uncommon that most people had eaten the pork, but people had eaten a range of banh mi, and all had become unwell. We then have a look at who became unwell, and it was more commonly males, but maybe a lot of people seem to be eating lunch or breakfast there on their way to work, and it seemed to be that male demographic, or maybe more males eat banh mi, and more clustered around the northern suburbs. People were really quite sick. It wasn't a mild gastro illness, but many people presented to emergency departments or required hospital admission for dehydration, and some people even had sepsis or ICU admissions, and it was really quite a severe illness for a lot of people. Many people were definitely sick for more than a week and had taken more than a week off work. So it was really quite a significant illness, which is compatible with salmonella. That's what we know. I thought we could just quickly touch on the people that did not eat at the venue. So these are 22 and ended up being 25 people who had stool samples and had a compatible illness that had that same MLVA, so that same exact strain of Salmonella typhimurium of interest, and they were quite interesting. So we often called these patients back to try and get more detail. Some of them maybe were just a little bit vague on where they eat out and had quite poor recall. Some likely were person-to-person transmission, so family members of those that were linked. But there's still probably about 20 patients who didn't seem to have an obvious exposure. And we asked quite an in-depth history then of all their high-risk salmonella consumption. So chicken, eggs, all their brands that they eat out and in, and how they cook them and who else eats them, and dates and brands and things. We didn't find any common source. Something that we also ask is we make sure we ask patients if they have any particular foods they don't eat. So for some religious reasons, if they don't eat pork, that's quite helpful to guide the investigation as an unlikely source, or if people have an anaphylactic egg allergy and are still getting sick, it's unlikely that the egg is the common source. So determining who is at risk. Well, this is where, again, this is all happening concurrently, but we do need to communicate with people like Henry and the rest of his Environmental Health Department food unit colleagues, and also our Environmental Health Officer colleagues in local government, and discuss our findings about what we've found so far, who is being exposed, what they're eating and what dates they were there, our hypothesis, which I'll show soon, and then also we ask for some guidance. Are there other questions that we should be asking or other food exposures that we should be thinking about to ask patients on? Again, our hypothesis is something that changes over the course of an outbreak investigation, but this was our early hypothesis that the Salmonella typhimurium cases, they were all linked to the consumption of a banh mi at one particular venue, and that had contaminated ingredients that were present across all types of banh mi between those weeks of exposure. To compare the hypothesis with facts, we need, I guess, ongoing case finding to see if we find any other evidence that contradicts what we've known so far. So we do that description of cases in terms of their characteristics and dates, but then importantly, we need the environmental investigation and findings to be done as well. I put there that sometimes a more systematic study is done, and many of you might be aware of case control studies, and they are sometimes done when the source is less clear. And a case control study asks people a range of food items, what they do and don't eat, and there's then does some statistical analysis to see what the most likely culprit is. And that wasn't done in this case because there was quite a clear source from the beginning, and so we didn't put the resources into doing that. As I was saying, these are all going together and not just happening one by one, and it's important that we keep doing each of these steps. And one of those steps is, I think, to keep finding and counting cases, and that's maintaining surveillance. As you can see, the numbers were gradually dropping off, but there was a few cases, and I don't think it's too much interactive here, so I'll just keep talking. But this was quite interesting that there was a couple of cases here. These cases here, actually, after control measures were put in place and it goes away, these are normally expected, and that's because of the incubation period of Salmonella. So people can get unwell up to 7 days, but sometimes even longer after exposure to the food. And the other thing that can happen is there can be person-to-person transmission within a household, which prolongs that period as well. Even more concerning, though, was when there was a few more cases even later that occurred, and we had information trickling through on these new cases. And that was several weeks after the initial outbreak had been detected. And after control measures had been put in place. And we contacted these cases and found that they had both consumed not banh mi, but crispy tofu dishes a couple of weeks after the control measures were put in place. So this was something we were able to communicate with our environmental health directorate colleagues who communicated with environmental health officers to do further rapid investigation and control of that. And then, as you can see, we kept up our surveillance and counting cases, and no more. So all resolved, which is great. Preparing written reports, I guess like anyone does that. That's just to say the department clearly does them as well. And some of those that we do sit reps within the department. We also brief up to other people within Department of Health, so the minister's aware of any large outbreak. Also, in case of media inquiries, there are particular lines there that can be said, particularly over a weekend. And then there's national reporting requirements around events such as this as well. Lastly, executing control and prevention activities. I think that's really everyone else's part of the investigation and response to an outbreak. So I'll hand over to Henry for some more of that. But just saying that We don't get to go out into the field much, but do behind the scenes, but very much appreciate and think it's very interesting, all the really important frontline work that's done. So in summary, this was a pretty large investigation. We ended up with 182 cases of illness, and of those 145 were linked to this single venue. And our role here was we had an epidemiological investigation that complemented the work done by the Environmental Health Department and environmental health officers, as well as the laboratory. And I think that teamwork all worked really well together to investigate the source and ensure that it was controlled. And we can also think about lessons learned to prevent and mitigate such outbreaks in the future. Some acknowledgements there, and I'm sorry if I've forgotten everyone, but I couldn't name everyone in person, but yes, I was just one very small part here. So I'd like to thank all the teams that were involved in both the outbreak, but also my learning around this. That's all. Thank you. Henry.
Thanks, Alison. Thanks for that. I'll just grab the screen off you now. Is it coming through okay? Great. Okay, thanks, Alison. I'll be covering the environmental health investigation part of this foodborne outbreak case study. So as you have heard from Alison, you can appreciate there's a lot of work that goes in to the investigation at the very early stages. So when, as a local government, when you receive that one-page local government briefing on an outbreak, all that work from CDCD, AusFoodNet, and also the diagnostic laboratories, many hours from expert professionals has been put into compiling that single-page brief that you have received. And AusFoodNet would have done countless hours of case interviews as well to try and pinpoint where the outbreak was, and also what the suspected food that we'd like to investigate further into. So you can appreciate without all this epidemiological work that goes behind this briefing, environmental health will be pretty much driving blind, and we'll be pretty much stabbing in the dark of hoping we'll find the right offending food. So hopefully from that presentation from Alison, we can appreciate how much work actually goes behind that, which is a very strong and powerful tool and data set that environmental health would be relying on when doing outbreak investigation. Before I go on with my investigation, I would just like to acknowledge City of Stirling for their sterling efforts in controlling this outbreak, especially Nicole Foxcroft and Marco Skekic. Initially, we've requested them to do this presentation, but they're unavailable. In fact, Nicole is much closer to Alison at the current moment in Europe. So, but yeah, we'd really like to thank City of Stirling for the great effort in attending to this outbreak and the controlling efforts, and also the really good efforts done in liaising with the food business. This is an outline of what I'll be covering on. So I'll cover on our role as EHD. Then we'll dive into the case study of this outbreak. And then we will take away some key learnings, hopefully that will assist you in your food safety assessments and to give you some pointers on where to look out for. So where do we fit in terms of the big picture of foodborne illness investigation, or outbreak investigation rather? So in Environmental Health Directorate, we do run the food surveillance program, the many hundreds of food samples that local government collect every month and submitted to Pathways. Pathways actually share the data or feeds it directly to us, so we have good visibility of a big picture on where the food safety risks are. And addition to that, we received the pathogen notification data from private labs as well. So basing on that, we have a really good catalog of non-compliances and where pathogens are detected in food. And that is a really good background data which we use to profile the risk for foodborne outbreaks at the early stages. In addition to that, we do have a catalog of some Salmonella serotypes, the MLVA types, and also whole genome sequencing data from previous samples. Everything from farm level through to food business, where there's surfaces that were sampled, and through to the food itself. And with whole genome sequencing, it's a pretty powerful tool. I would also like to mention PathWest here as well. So the whole genome sequencing data is kept by PathWest and also MLVA data. And they have been really helpful with outbreak investigations because they can very quickly match case data to previous data to see where it might have possibly come out from. And with MLVA and whole genome sequencing, it can give you some sort of hint in terms of where the possible food source might be by the relatedness or how closely matched they are. And in addition to this, we do have lots of previous outbreak findings, which will give us a few pointers on where to look with current outbreaks. Our main role is mostly coordination with local governments and also with AusFoodNet. And we'd like to acknowledge the good work that local government is doing on the ground. And because there's 137 of you, we do have good coverage over the whole of state. And without you guys, there's no way that this can be investigated quickly and contained. Okay, so we'll dive into this case study now. It all started off on I think it was a Wednesday afternoon, I remember. It's right after a workshop at 5 p.m. I got a call from Nicole from City of Stirling, and she said we might have a problem. I'm like, oh, great. 5 o'clock after a long day. Pretty much the early indicator that they're picking up is that they've got an increased number of complaints on this food business. And when they checked their social media page and Google reviews, there were also a lot of negative reviews and comments that has been received. So there is a really good indicator that there is something has gone wrong and there is an outbreak that's occurring. So very quickly, late afternoon, I gave AusFoodNet a call, and they have also mentioned that the laboratories have been informing them that they're seeing a spike of number of Salmonella isolations, particularly in the northern Perth region. So that rings the alarm bells that there's something going on. And immediately, a good thing from this is that we have a suspected food business. So all this would not have been possible if local government did not keep a good log of the complaints that you receive. And have that good surveillance and record keeping of those early indicators and complaints that you receive from public. So if you have not already got a system in place to log these complaints and tag it to food businesses, it's something worth setting up. And it will be a very good tool for us to be on the front foot when things go wrong. The day after, City of Stirling ducked out to the food business and collect a whole bunch of food and surface samples. So from here you can see that for the food samples, it includes ready-to-eat ingredients and also raw ingredients. So when you do your food sampling, this is something to take note of. It is important to sample individual ingredients and not just the finished product. Reason for this is because it is more sensitive when you test the actual ingredient itself, and if it's raw, it's better as well before the kill step. And based on this, you will be able to narrow it down also to the particular ingredient that might be contaminating the finished product. In addition to this, they sample a whole bunch of surfaces, so the prep sink, the prep bench, the colander, the cutting board, and the robo coupe. So all these are the high contact surfaces that the food will get in contact with. And this is the results that came back. So most, all of the samples were all clear except for the robo coupe. And when Pathwest did their whole genome sequencing, and match it to the case stool sample isolates, they found that it is highly related. I think it's somewhere between a 2 SNP difference, meaning that they are indistinguishable. So what went wrong? So this is the key findings. The immediate findings with that non-compliant equipment where the pathogen was detected was that it was found that this robo coupe or this commercial blender or mixer, it has parts of the equipment that traps food, and you really do need to fully dismantle it for proper cleaning. And the food business have not been doing that. So ideally you would have disassembled these parts here. You can see that on the lid. You've got a rubber seal, and there's a lot of removable parts as well, which do need to be cleaned and sanitized to ensure that there's no pathogens that is left over or there's any residue from previous processing of raw foods. So from this blender, City of Stirling investigated further to see what ingredients is processed with this equipment. So the first is to blend livers and various ingredients, which will be processed into pate using banh mi. This blender was also used to make store-made mayonnaise, which contained eggs. And also, the blender is used to blend roasted rice, which is used to make a tofu mix. So I'll cover each one now. So in terms of the process that pate was manufactured, City of Stirling found that the livers were not fully cooked to 75 degrees prior to blending. This could most probably be the cause of the blender contamination. Though the pate itself, it goes through a final cook via steaming and baked to 180 degrees. So possibly the pate itself is not a contaminated ingredient, but rather a source of contamination for the blender. So the pate batches is then cooled and frozen and can be used up to 10 days. The control measure in this instance is that the local government, City of Stirling, recommend the food business to cook it for a longer time to reach that target temperature, and also to train the staff to check for temperature as well. So these are some of the pictures. So you can see that the first step for the processing of the pate is that they'll steam the chicken livers first. And you can see that on the thermometer readout there, it did not reach 75 degrees. Then it's the livers are grilled on the grill, and then you can see that some liver pieces still don't reach 75 degrees at that stage. Then after that, it's chopped up and also fried with other ingredients, and some pieces do get up to more than 75, but the thicker pieces still did not hit that temperature of 75 degrees. So that mix there on the bottom left-hand corner, you can see that is then popped into that blender and blended. So if there's any pathogens that is within the liver itself, it can easily contaminate that blender. That blended mix is then steamed and baked to 180 degrees, which makes that ingredient fully cooked. For the raw egg mayo, this food business did not acidify it to a pH of less than 4.2. And they do hold the batch for quite a few days and not consumed within 24 hours. The point that I like to make is that the mayonnaise is processed in the blender, and there's no further kill step after mixing of the mayo within the blender itself. So you can imagine any residual pathogens that's on the surface of the blender can easily get into the mayo, and then it can just multiply within that mix. So immediately, CEO Sterling directed the store to cease using store-made mayo and switch to commercially made mayo. And this is a very important response by CEO Sterling, and this even way before the formal lab results came out. So the day that they suspected an outbreak, they issued this directive to cease making, to use the store-made mayo. And because it's on a Wednesday afternoon, late afternoon, you have those 3 days or potentially 4 days that we have prevented further exposure to the public. So this is a really good preventive response by CEO Sterling. It's really good call because otherwise we would have a lot more than 140 odd cases from these premises. And when the RoboCoupe results came back as positive, they prohibited the use of that equipment until it's properly sanitized. And all clear on verification sample results were obtained. Added on to this, the staff was instructed to be properly trained to undertake this cleaning and sanitizing. And this one additional measure the food business has been asked to put in place. So the immediate question that we have, was it from the egg? So we're fortunate enough that this food business had only used one egg supplier from one egg farm in WA. So we've immediately mobilized and done on-farm sampling of this egg farm. They had 4 production sheds and also a growing shed. And what was really interesting with this MLVA for this outbreak is that it's an MLVA we never observed before in egg farms, and we've sampled this farm previously as well, and this MLVA was not observed on that farm. So this immediate response was to pretty much to rule out if this farm have, or the flocks on this farm have contracted a salmonella infection. And if that's the case, then we will be suspecting more cases to come in from the community if it's actually from the eggs of this farm. We've also we sampled all the sheds and also the growing shed to verify the vaccination program, and the results came back all clear. So from this, we can confidently rule out that it is not the eggs. So then the other high-risk ingredient was the liver. So is it the liver? This is where we hit a snag. We couldn't go on further. When we did our trace back investigation, there's just no way to narrow it down to a particular farm because how chicken meat is produced from, where livers come from, you do have multiple farms supplying a single abattoir on a single production day. And these livers are consolidated from multiple flocks and then also on supply to different suppliers and intermediary distributors. So you can have possibly up to 10, 20 farms that we're looking at, and it's pretty hard to narrow it down to a particular farm basing on a batch that might have been used. So basing on that, we did not pursue further with this trace back. And furthermore, with the pathogen notification or salmonella notification in broiler meat, the sensitivity is quite low because you're looking at 2 to 4 samples a day, and that's after chlorination of the carcass. And we know that salmonella accumulates in higher concentration in livers. So basing on the carcass data and historical data from abattoirs, that's the data which we could not trace back further. Alison did mention that we did have a long trickle of cases. That's when we were a little bit puzzled where was it coming from. Alison did mention it was the crispy tofu mix. So it is this ingredient here which we have narrowed down to. So that blender was used to blend a roasted glutinous rice mix. Glutinous rice, after it's been roasted, is blended into a flour, and this ingredient is then used to make up a tofu mix. So in this tofu mix, there's other ingredients that's fully cooked and also blended, not with this blender, but with another processor. But with the blended glutinous rice flour, it is added onto this tofu mix without further cooking, and big batches are made and frozen for later use. And with the store, when they make this blended roasted rice mix, they do make a big batch, and it will stretch them out for quite a few months. So from there, City of Stirling have identified that this potentially contaminated ingredient has been used to make subsequent tofu mix product. And from there, the disposal of this contaminated tofu mix has been overlooked in the initial intervention. City of Stirling has also tested a few tofu mix samples, and it did come back positive for the outbreak MLVA type. So after all the batches have been disposed, there's no further cases. So this is a very good, important learning as well from the disposal of contaminated product. This shows that it's just so easy to miss in an outbreak because there's so many ingredients out there. So in this instance, it's just that one ingredient that has been pre-processed and processed in large batches and stored for a long period of time, which has been overlooked. So onto my last slide. What is local government's critical role? Keep up with your compliance assessments. Without it, that's the first line of defense to pick up anything wrong in the food business. So without your role and going out to do your assessments, we'll be definitely seeing a lot more outbreaks. So keep up the good work and do it well. And this is it's the bare minimum that we can do. And it's really the health and safety of the public is really in your hands to make sure that these food businesses are doing the right thing. Continue to educate the food businesses on salmonella risk. So in this instance, you can see it's a pretty steep learning curve for this food business here, that a very minor risk that have been overlooked can cause an outbreak of more than 140 odd people just from that one single premises. We've also learned that focus on the cleaning and sanitizing of equipment and surfaces, especially those which is hard to clean, and those in contact with ready-to-eat foods. And continue your education on the importance of cleaning and sanitizing with the food business. In this instance, you can see that most probably what they did was just to give it a quick clean and just a quick soap, and that's it. And that rubber seal on that lid there for that RoboCoop really do need to be dismantled and properly sanitized for any residue pathogen to be disinfected. So keep up the education in that space as well. I'd like to end off with one last piece, which is very much underdone at the moment, which is food safety culture. If you think about it, this food business has been in operation for quite a few years now. And in the past inspections of these food businesses, there's really no major non-compliances. So this really points out that additional edge that is missing, which is the food safety culture of the business, to really take pride and to really take note of the little things that adds up to a big picture food safety risk that has been overlooked in this instance. So food safety culture is something that we would like to build up in the upcoming months in WA. ECU has recently set up a food safety culture course, which we've circulated the details around in our newsletter. So do keep an eye out for future courses that they will be running. But yes, it's a very important aspect of food safety that needs to be promoted in food businesses, because they can be ticking all the boxes, everything might look hunky-dory, but an outbreak such as this can still occur. And it all comes down to culture and how much they take pride in food safety and the work that they do. Okay, with that, I'll end my bit, and I will now hand over to Danny and Abby to share on the work we do on meat auditing. Okay. I'll just launch the slide now. I'm just sharing the window now, and over to you, Danny and Abby.
All right, thank you, Henry. That was a very enlightening and entertaining case study that we got to know, and we got to learn the importance of our colleagues in OSCODNet, the epidemiological team here in Food Unit, and also our colleagues in local government came together to find the source of the infection, and also were able to introduce control measures and hopefully mitigate any future occurrences. So meat is another one where we need help or assistance from our colleagues in the local government, and how we get together to control or have any regulation of meat in WA. So good morning, everyone. In this section of our webinar, we'll learn about meat auditing and meat for human consumption, and how is it regulated in WA as a combined effort between the local government and the Food Unit in Department of Health. So in the upcoming slides, we will explore difference between export and domestic meat businesses, discuss regulatory oversight of WA meat and poultry processors that operates as a wholesale. Some of them do operate as wholesale and retail, or some of them which are retail-only premises. So these premises will include different types of abattoirs. Some of them will be standalone boning rooms. Some of them will have small goods manufacturing, and also ultimately we'll learn about retail butcher shops as well. Right, these would be the presenters. Some of our colleagues in LG in the local government may know us, and some of them might have interacted with us, certainly. But those who don't know us, I'll be joined by my colleague, Danny, who has been working in the department on wastewater, subdivisions, and tobacco regulation prior to moving into the food regulation. He has a degree in microbiology and environmental health. He is currently involved in food business assessments, food safety program verification. He's also involved in projects for outbreak investigations, foodborne illness reduction strategy, and he also represents Food Unit in some national food safety working groups. Myself, I have a master's in food science and technology and have been working in the industry prior to moving into the Food Unit. My role focuses on auditing of domestic and Tier 1 export meat processors. We'll learn about what's a Tier 1 meat export meat processor in the next slides. I also work in verification of meat food safety programs, and also I sometimes assist in food outbreak investigations, also assist in industry, state and federal agencies for the subject matter. Right, what other type of meat businesses that we will talk about today? So the meat businesses that we'll look into would be slaughtering establishments. They would be abattoirs for red meat, poultry processors, so poultry slaughtering establishments, or some of them would be game meat slaughtering establishments as well. We would look into boning rooms. They would be standalone boning rooms that have red meat processing, poultry processing. Some of them would be wild game meat processing as well. We would look into further processors. That would be ready-to-eat ones that process ready-to-eat meat products such as salami or pate, biltong, etc. Some of them would be further purchases for non-ready-to-eat meat products. So they would basically involve slicing, packaging into retail packs, sometimes value adding as well. We'll look into retail butchers. So they might be making raw and cooked meat or sometimes small goods as a retail premises. Some of them may move on to ready-to-eat meat products such as jerkies and others such as renderers and transport. Now, some of these type of meat businesses might be working together. So they might be present in a particular premises. One or more of them might be present in a particular premises. One of the examples would be abattoirs that might be slaughtering establishments, but also have a standalone boning room associated with it that helps in breaking down the carcasses into further processed products. Some of them might have renderers that are present into those premises as well, and some of them might be involved in transport. We will discuss a little bit more about abattoirs in the upcoming slides because of their risky nature and sometimes more additional requirements as per our food regs. These are the regulatory framework that governs meat processing for human consumption in WA. So on to your left, Export Control Act, that would be primarily for export meat operations. They also have export regulations known as rules that governs different commodities under the Export Control Act. Of course, Food Act and food regs for our WA food premises. Then for the Food Standards Code and the standards of 423, which is the primary production and processing standard for meat. Also standard 422, which is primary production and processing standard for poultry meat. Then we also look at the standard of 162 and standard 221 will be involved as well. On to your right, these are the adopted meat standards. They are adopted under the food regs. So the standards they correspond to that type of commodities. So for red meat, 4696 is used. For poultry meat, 4465 would be the requirements, and for the remaining commodities, those are the standards which are adopted under our food regs. So this is a simplified overview of how meat is reviewed in WA. A more detailed version will be soon available in our website. Once that web page is ready, that would be available on our website, which will have more information about each specific commodity. So we move on to our next slide, and we'll talk about export first, and then we'll move on to the domestic premises. So export meat premises. So these meat premises have actually acquired export permit from Department of Agriculture, Fisheries and Forestry, which is the Commonwealth Department that governs Export Control Act. So these meat operations have acquired the permit for specific commodities. Now these commodities may range from beef, lamb, or different meat products that can be exported. This means that the business may produce a wide variety of products such as beef, lamb, pork within the same premises, but may want to export only lamb, for example, to the Middle East. Thus, the permit will actually specify that they can only export lamb, and they will be only able to export to the Middle Eastern country that they want to export. This shows that the permit are also region specific. That means the business will have to apply separately for each country or region. So as we learned, the export meat premises would have Export Control Act, will be captured by the Export Control Act, governed by DAF. It will be also captured by WA Food Act and the food regs, which will be governed by the local government in WA. So the resulting commodity would be compliant under importing country requirements and WA food legislation requirements. So importing country requirements briefly, so these are actually country specific requirements for meat products. So each country might probably have specific requirements that they want to achieve for the meat to be able to export to that country. So these importing country requirements are actually overseen by Commonwealth Department of Ag, as we know as DAF, and they, for any changes in the future for the importing country requirements, they will be using direct communication or audits or any advisory documents to these export meat premises to let them know about upcoming changes to the importing country requirements. So this shows that DAF ensures compliance to the export legislation and also the importing country requirements for exporting meat by these export meat premises. So what happens if a product is rejected for export? Sometimes that product may still comply with Australian food standards and thus might be compliant to the local legislation. So in this case, the business or DAF may notify WA Health for seeking permission to be able to be released into the domestic market. So it's done on a case-to-case basis. WA Health will look into the product, look into the consignment, and if it satisfies all the requirements under the food standards, also the Australian standards, and if it's possible to, it is compliant under the food legislation here, it might be able to be released for domestic use. So how a meat premises or a meat business in WM may become an export meat business? So they can seek export permit in these two ways, majorly. First, the meat business that is operating or that wants to operate here may seek food business registration from the local government. Then the local government will be the enforcement agency under our Food Act. This meat business might be operating as a domestic meat business for a short while or maybe working for a long time, and in the future they might look for export permit. So that way the business will apply for export and they will have to go straight to the Department of Ag, the Federal Department of Ag, to seek export permit. Another way that can happen is the meat business applies for export registration directly to DAF. They will acquire the export registration. In this case, the local government will still be an enforcement agency under Section 5 of the Food Regs, and the export premises will have to notify local government of their operation. As I had mentioned earlier, abattoirs have a little bit of a different requirement. Under Export Control Act, they can work as either Tier 1 or Tier 2. So they are only applicable for a red meat or wild game abattoir or a standalone boning room. So they can acquire a Tier 1 registration or a Tier 2 registration. So for Tier 1 registration, these are usually the domestically run abattoirs or boning room that in the future may seek export permit to limited amount of export markets. So under Tier 1 scheme, they would be able to seek export permit to those limited export markets. So these are markets primarily that accept the Australian standards. So in this case, they would accept the Australian standard for meat production, AS4696. WA Health here actually audits these Tier 1 premises on behalf of DAF. Tier 2 premises have no restriction in any market, so they would be able to sell their products all over the world. Obviously, they will have to be compliant to the market-specific requirements. So like we saw earlier, there would be specific requirements for either EU or Middle East or the United States. So they will have to meet those specific requirements. DAF will ensure that they meet those specific requirements and sometimes will host these market representatives to visit these premises here in Australia to go through the audit themselves. These Tier 2 premises, the abattoirs and boning rooms, will also have a veterinarian employed by DAF on site to ensure compliance, and DAF will conduct regular audits. So it is to note that in WA, local government is the enforcement agency for both Tier 1 and Tier 2 premises. Now let's talk about domestic meat premises. So domestic abattoirs will also have specific requirements just for the abattoirs. We'll look into it in these upcoming slides. So for domestic abattoirs, we know that they will have to go through a food business registration under the Food Act. So local government will also authorize a meat inspector. WA Health will ensure the food safety plan is approved and complies with the Australian standards, the adopted Australian standards under the food regs. And WA Health will conduct regular audits to ensure compliance for those Australian standards. For red meat abattoirs in WA, we have another WA agency called WAMIA, or Western Australia Meat Industry Authority. They actually provides a slaughtering license to red meat abattoirs. So these red meat abattoirs will have to contact WAMIA to obtain a slaughtering license. Now, abattoirs might have other requirements under primary industries, Department of Primary Industries, or DUA. So they will have to contact them as well. They can involve obtaining a PIC under DPIRD. So they are usually a code for specific livestock handling premises. They might have to contact DUA as well for waste management. And these will have to operate under an arrangement as per Australian standards. They will also have to have an authorized meat inspector that has to be present during slaughter. They will have to adhere to specific capacity limits set by either WAMIA or DUA. So they might have to make sure that they don't go over those limits on a regular basis. They will have to have proper essential services and waste management to be able to handle processing of the livestock. And they will also have to apply approved brand on carcasses. So we'll learn about approved brands in the next slides. Now this actually shows us that it is difficult for a mobile abattoir to work as a food business. So many of our colleagues in the regional areas particularly would have come across inquiries from the public about running as a mobile abattoir. So these are the requirements which will be applicable to a mobile abattoir as well, and may make it difficult for such a business to be operating as an abattoir in WA. So food regs in WA have a requirement for branding of carcasses after it's been processed for human consumption, and also carcasses for animal consumption. So section 24 of the food regs has the requirements for those brands and the location of placement for those brands on a carcass. It actually shows which premises it has been slaughtered before it has been sold off to further processing. So brands are provided by WAMIA. So the Western Australia Meat Industry Authority will provide them a license number, and these brands will have that license number on it. Brands will be monitored by Department of Health in our regular audits. Illegally operated abattoirs will generally have no brand placed on them. So our colleagues in the local government would be able to identify if a carcass that is present in a meat premises doesn't have a brand, it might likely be slaughtered illegally, or sometimes they may have a fake brand that is used.
Now we can look at a whole.
Sorry for the interruption there. All right, so yeah, well, let's look at the wholesale meat premises on the next slides. As I mentioned earlier, abattoirs are a wholesale meat, considered to be part of wholesale meat premises, and they would have the same requirements. What are we gonna see in the upcoming slide? So when someone wants to start a wholesale meat,
And following is the advice that
provide to them.
Yep, you good.
For the interruption there again.
Okay. Yep, you good.
Right, apologies for those interruptions. If you can move forward. So, like I said earlier, abattoirs are the type of wholesale meat premises, and all these requirements would be applicable to them as well. So when someone inquires for starting a wholesale meat premises, so these are the requirements that we advise it to them. First is to contact the local government for information and registration. Then we ask them to seek training in HACCP. So this ensures that they have all the essential skills to be able to operate their food safety plan, which will be approved by Department of Health here under the Australian standards. They will be asked to develop a HACCP-based approved arrangement or a quality assurance program, as we discussed earlier, that is based on the requirements of the Food Standards Code and all the relevant Australian standards. They will seek verification of that food safety program and will send it to WA Health for its verification. Once they acquire a successful verification, the report will be sent to them and also the local government. Then they will have to, meanwhile, introduce microbial monitoring for verification of their production. After the successful verification, they will have to undergo auditing of their program against these Australian standards that are adopted under food regs. This occurs usually more frequently once they start operating, and once they have successful audits, they might be put onto lesser frequent audits. So roles of the food unit in Department of Health would be verifying and approving the approved arrangement that is based on the Australian standards. We will undertake auditing against these Australian standards depending on the type of food business. So abattoir might have, or a small goods processing might have higher frequency of audits because of its risky nature, as opposed to a standalone boning room that might have a lesser frequent auditing schedule. The auditing reports and the results would be sent to the local government as an enforcement agency, and the Department of Health will also be involved in closing of these corrective actions raised during the audits. Now, sometimes these meat businesses will be unsuccessful, will have an unsuccessful audit due to numerous major or critical non-compliances, and might have a possibility to cause a wider public health issue. So this is when enforcement agencies can take appropriate enforcement actions after receiving the audit report. They can also they will also undertake normal functions of enforcement agencies, and they will also be involved in carrying out investigations. So that, like we discussed earlier, they can be due to foodborne illness outbreak, or can be through complaints coming onto them, can be pathogen notifications, or can be food recalls as well. Now, during an audit, usually the audit can last for 90 minutes to 2 days. Like I said earlier, depending on the type of commodity that the food business is involved in. They can be a simple business like a boning room, so the audit can last lesser number of hours, or it can be a complex food processing premises. They can be small goods that produces a wide variety of small goods, so they can take 1 to 2 days. So lead auditor will invite the local government as an enforcement agency to accompany for the audit, and the audit will usually be having an introductory meeting. Then there would be a walkthrough of the premises. There would be review of the program and documentation. We'll go through all the record keeping for verification of their processes. And also it will involve closing meeting at the end of that audit that will discuss the result, that will discuss what are the findings, if it's necessary, the corrective action requests, and then the follow-up schedule for those audits. We'll move on to the different type of domestic premises. So they can be a wholesale and retail, like I've discussed earlier. Some wholesale meat premises can have a retail section associated with it as well. The remaining section of this webinar, I'll hand it over to my colleague Danny to take it.
Unfortunately, we do have some technical issues going on at the moment. Okay. All right, all good. Thank you, Henry, our technical expert.
I'm gonna switch it to this.
With us, everyone.
All right. All right. Okay, all right. Do let us know if you have trouble hearing us, and we'll see what we can do about that. Basically, our butcher shop's covered by the Australian standards. Okay. So under the food regulations, abattoirs and processing premises are required to comply with the requirements of the adopted standards. Oops. About this. All right. So under section 17 of the food regulations, a processing premises means butcher's premises where the butcher supplies meat and meat products for further processing and sale, whether or not in conjunction with retail sales, but does not include butcher's premises or other premises if the sales are predominantly retail sales. What are predominantly retail sales? Unfortunately, there isn't a current definition of predominantly in the regulations or the food standard codes. So we do need to look at the intention of the law here. All right, so we just use an example. So if we've got a butcher store and then the local government learns that they're supplying wholesale as well and supplying to restaurants and IGAs or Farmer Jacks, etc. Is this a predominantly retail premises or is it now a processing premises? So the local government will advise the Department of Health. We will then conduct an evaluation to see if the premises falls within the scope of the Australian standards. So we usually just send off a form to yourselves or the premises and have them fill that in. And we'll use that information to actually conduct the evaluation. What we'll use there is we'll have an evaluation based on the proportion of retail versus wholesale sales. That's the key area where we look at. However, we'll also take into consideration the volume of production, the type of product being made and the target population. So if the product is a ready-to-eat meat product, then we'll consider that as a higher risk. If they're selling to, hospitals or something like that, then again, we're upping the risk factor there. So after that evaluation, we'll then either categorise it as being under the wholesale side of things, in which the Australian standards needs to apply to the premises, or it will just fall within that predominantly retail side. So let's have a look at what needs to require at the retail side of things. So then again, we just divide into two different sections. Okay, if the premises is only making a raw product, then it's just going to be compliant to the normal food business under the Chapter 3 side of things. However, if they're making ready to eat, then they also need to comply with Chapter 423, Division 3 of the Food Standards Codes. So ready to eat meats can include UCFMs, hams, cooked products, dried meats, and there's some other ones included as well, such as pate, etc. Okay. So under Division 3 of Standard Food 423 of the Food Standards Codes, a producer of ready-to-eat meat must implement a food safety management system to meet either Table 1 or Table 2. So Table 1 is basically good. Back over. All right. So basically under Table 1, there's 4 requirements that are verified and assessed by the local government. Or Table 2 is compliance with the Australian standards, and which is recognised under the food regs. The premises will actually choose which table they want to comply with. It's generally unlikely that a retail premises will choose to comply with Table 2, as the management system for Table 2 is quite a lot more involved, and you'll then have 2 regulators reviewing their work instead of just the local government. This option is sometimes taken by premises that are doing wholesaling, but then convert to retail only, and they've already been under the Department of Health audit schedule. So if we're looking at Table 1, the requirements here, so document all stages of production, identify all food safety hazards and controls through the use of a HACCP plan, document compliance with the standard 322 of the code, and document the management system set out in clauses 3.3 to 3.10 of AS 4696. All right, so what does that actually mean? So HACCP plan. So HACCP plans are generally the same regardless of what sort of management system they're under. That involves looking at setting up a HACCP team and doing meetings of the program, creating product descriptions, flow charts, doing a hazard analysis, using a decision tree to determine critical control points, having a hazard audit table, using CCPs, and using a suitable validation and verification methods, and also just developing some work instructions on how to control those CCPs. So then documenting some of those areas. So under the HACCP side, they will need to document the CCP records for each batch, and also the support programs and program amendments. Under 322, they do need to document things like food receipt, storage, cooking, cooling, display, temperatures, transportation, traceability, pest control, maintenance, and cleaning and sanitation. Under the AS 4696 side of it, where it's at 3.3 to 3.10, that includes having a policy statement, having an organisational structure, include a verification system, corrective actions, and conduct internal audits or management reviews. For a small premises, internal audits aren't required, and we'll just be happy with management reviews. So under Table 1 there, so that's basically what they're required to do here. And under Table 2, there's a lot more additional information and processes there. The key difference between these tables is that an Australian standard compliant program will need to have up-to-date SOPs for all their programs, and the list of support programs are more extensive. On the table 1 side, there are a lot of operations that are already occurring in the premises. It's basically just documenting this information so it can be reviewed in assessments or investigations. The HACCP side will be similar between these premises. We'll look at creating a meat processor specific guidance document to go with the existing food safety program verification tool that is currently available online. It is a little bit outdated, unfortunately, but we were looking at making an addition onto that one. This will be useful for when you're doing verification activities. All right, so where can a premises get more information for developing their program? They can use consultants. It's a bit expensive for a small retailer, but they do have that option there. Qualifications in HACCP, undertaking formal training is always beneficial. The 2 main ones I would actually recommend, and this is always a good idea to point a retail premises towards, pre-existing materials that are available. So this can be from other state health providers, for example, New South Wales Health, Prime Safe in Victoria, and PIRSA in South Australia. All have existing templates, etc., that might be usable by the business. They could also use industry bodies. So, for example, the Australian Meat Industry Council provide a program diary for the retail meat industry that is actually quite good. We've had a good review of that one, and I'll show you some examples of that one here. So there's all the documentation that they just need to fill in for critical control point monitoring. There's a cooking log there, hygiene and maintenance reports, calibration records and chemical registers. This is information that they're required to have available. And this is all available from EMEC as well. So, and it's all in the one document, which provides a 6-month supply of records for the premises at I would actually say, quite a reasonable price. Premises can also use research bodies such as CSIRO to obtain information on what would be a suitable critical limit as well. Generally, we've also got some other options available as well. So this document from AMEC doesn't actually include UCFMs, but that can be obtained from other sources as well, such as this is actually obtained from ACT Health, UCFM Manufacturing Food Safety Plan, and it goes through a lot of the information that they need to capture, such as they've got including like the hazard order table, and which lists all the CCPs and critical limits, etc. The verification of the programs made will need to be completed by the enforcement agency. It's quite difficult to do sometimes. The local government can request direct assistance with us through the food safety email address if you require further help with your verifications, or if you want to check that a critical limit or another parameter is suitable. Feel free to contact us. We'll actually provide some assistance where we can. Do note that we are out on the road quite a lot doing audits, and we do cover the whole of the state, so we might be out in regional ways as well. So frequently asked questions. So this is just a general FAQ for meat. These are 2 of the most common questions we get. Mobile abattoirs allowed in WA. Basically, the Department of Health and WAMIA, we don't really support mobile abattoirs for the sale of meat, but we do allow it for production of pet meat and other non-food products, and also farmers are allowed to use mobile abattoirs for on-site slaughter for their own consumption, because that isn't considered as a sale, so therefore it's not a food business. Are kangaroos allowed to be hunted and sold as food? Yes, however, they need to be slaughtered by an approved harvester and processed through a licensed wild game field harvesting depot and wild game processing premises. There are other requirements for harvesting of kangaroo that is licensed by DPAW, which is the Department of Parks and Wildlife. This generally includes obtaining a license, which keeps the harvester within a quota that covers animal welfare concerns, having permission of the landowner for harvesting, and also just required to have a firearms license as well. There will be further information available on our MEAT website with these, and also just more details on the actual specific premises types. We'll have that on our website probably in the next couple of months. It's just currently under review at the moment. So that's pretty much it from our side. So I just want to say thanks for listening into this one, and thanks to all the EHOs that actually attend our audits. These audits generally provided great learning opportunities for ourselves and also the EHOs, and it's really good networking on both sides. So thank you for that. And I'm going to be handing over to Rebecca Del Sar. Thank you.
Good morning, everyone. My name is Rebecca. I work in the food team as well. And this morning, I'm giving you an update on food business risk classification. So you'll be familiar with the document, the WA Food Regulation Food Business Risk Profiling. This is a document that we've had in place since 2009. It was developed based off the FSANZ priority classification system for food businesses, and it was developed in consultation with local government with some adaptations of the FSANZ system for use in WA. The WA risk system is not mandatory. However, local government are encouraged to use it for consistency across the state. We've been asking in our Food Act reporting about how local governments classify businesses and determine frequency of food safety assessments. And the data we've received indicates that approximately 50% of enforcement agencies in Western Australia are using the WA tool. The question was an open question, so there were an additional 31% of local governments that advise that they're using a risk-based approach, but did not specify exactly which one. So it's possible that they may be using it as well. In addition to that, there are also some local governments that had made some minor modifications to the tool, so approximately 5% of local governments, and a further 2.5% had used they're using the FSANZ priority classification system. Interestingly, there are a few other ways of determining assessment frequency, including a set frequency for all food businesses. A couple of local governments have developed their own tool, and a couple of local governments simply base their assessments on their staff resourcing availability and also on food business performance. So we've undertaken a review of the document, and it's actually been renamed now the WA Food Business Risk Classification System. The updates to the document are purely for the guidance around its use. So the scoring system remains the same. We wanted to avoid impact on local government because we're aware that this document is widely used. So there is no need to reassess food business risk classifications. So one of the main focuses in the updated guidance is to outline the intended use of the risk classification system. We're aware that there has been some confusion around its use, and occasionally it does get used for different purposes. It's easy to get confused because the risk is obviously it's integral to what we do in food regulation, and similar terms are used in other documents and activities. So in the update to the guidance, we've just provided some more clarification on what it's meant to be used for, and other similar documents that or activities that it shouldn't be used for. So the risk classification system is intended only to guide the allocation of risk ratings to food businesses for the purpose of determining an appropriate frequency of food regulatory assessments. So that is the frequency of food safety assessments. Now, it shouldn't be confused with the WA priority classification system. This is a regulatory requirement of Part 8 auditing of the Food Act, and this applies to food businesses that must implement a food safety program and have regulatory food safety audits. So that's food businesses that serve food to vulnerable persons, so your childcare centres, hospitals, and dairy food businesses. So the priority classification system is for the requirements relating to food safety programs and auditing frequency only. So it's completely distinct to the risk classification system. Secondly, just to clarify that the risk classification system is not for food safety risk assessment. So the risk classification system provides an overall sort of general risk rating for a food business. However, food safety risk assessment is a lot more detailed and complex. And so it's important to note that that's a completely separate process again. If you need to risk assess, the process includes identifying, analysing and characterising risk. So, for example, a risk assessment of a food would involve assessing detailed recipes, including the ingredients, the processing steps, for example, time and temperature for cooking, hazard identification and proposed risk mitigations for each hazard. And thirdly, the risk classification should not be used for determining food business compliance. So this is something we come across from time to time. The example provided here in blue is one that we hear of occasionally, where an EHO is wanting to use the risk rating from this classification system to determine if a food business can operate in a domestic premises. And we just want to point out with this one that there are actually no provisions in the legislation to use it for this purpose. And all businesses need to be assessed on a case-by-case basis. So in this example, food business needs to be assessed against the food safety standards 322 and 323 to determine if it's compliant. Obviously, we're aware that generally speaking, high-risk activities are not able to achieve the outcomes required by the code in a domestic premises, and it's likely they'll often need a commercial premises, but regardless of that, you still need to assess them individually, and any decisions need to be based on evidence gathered of non-compliance with the legislation. There are certain exemptions obviously contained in the food safety standards that can be granted by local governments to domestic businesses or temporary businesses as well. And it is the department's position that these should really only be granted for lower risk activities. So these exemptions relate to things like warm running water, the use of non-potable water, floors of temporary premises, floors unlikely to pose a risk, and hand washing facilities. But again, each needs to be assessed on a case-by-case basis. So you need to determine if or how the food business can manage the risk and whether the exemption should be granted. So moving on to the scoring system, which, like I say, there's been no changes, so you should be familiar with this. The form remains the same. The system is based on 5 risk factors. So we have food type and intended use, which is the risk of the food and whether it's ready to eat. The activity of the food business is the risk of the foods and food handling activities. Method of processing is whether there is a pathogen reduction step. The customer base is the size of the food business, with greater points for a larger business. And there are also lower points included there for charitable organisations, which are specifically fundraising businesses that are captured by Regulation 10 for food regulations. We also have a points reduction for food safety programs. And just with this one, it is intended for the voluntary implementation of a food safety program, so not mandatory. And it should be compliant with standard 3.2.1 of the code, where the business can demonstrate good food safety practices that reduce the risk. So you wouldn't automatically give a points reduction just because they say they have a food safety program. There actually needs to be a bit of an assessment of that to make sure that they are actually implementing it correctly and it's actually assisting to mitigate risks. So this does not apply to food businesses captured by standard 331, so vulnerable populations, or standard 44 dairy businesses, which have to have mandatory programs. So they remain high risk and they don't have a points reduction. In terms of the risk classification process, it should be done during the food business notification registration step, and the risk rating applied to a business will remain static regardless of whether of their performance, their food safety performance, and it should only ever change if there is a change to the food business activities that's actually going to change their scoring and their risk rating. So once a rating has been applied, the initial inspection frequency should be assigned. A food safety assessment frequency model is provided in the risk classification document, and that is based on the FSANZ priority classification system. The inspection frequencies can be adjusted within the frequency range for that classification, and that can be adjusted based on food safety performance and risk reduction activities. And a frequency adjustment model is also provided in the document, which is taken from the Environmental Health Australia food safety standard of practice. So we have a new web page for the risk classification system. The updated document provides all the guidance that I've outlined today. There is also a risk classification calculator, which is an Excel spreadsheet, so that calculates the score for you and the risk rating. And the webpage also provides links to other resources on the other topics that I've mentioned today, such as the priority classification system. There's a link to notification and registration, to the food business assessment and home-based food business web pages as well. And finally, if you'd like guidance on using the risk classification system, or if you'd like to provide any feedback on this system, please feel free to email us. So our email is there on the screen. And that's all I have today. So thank you very much. I think we'll move to questions now. We still have Henry, Abby and Danny here. So if you'd like to enter your questions, then we can get started on those.
So King, I don't think we have any questions from the audience.
You can enter them into the Q&A if you have anything for us.
Great. Looks like we don't have any questions, but yeah, feel free to reach out to us via foodsafety@health.wa.gov.au if you've got any questions after this presentation. We're more than happy to provide you any information that you need. We do have one come through by James. So I'll just publish it now. So James is asking, for the food poisoning outbreak case, banh mi rolls are notorious for food poisoning outbreaks. Were controls put in place, previous inspections for the making of safe in-house mayonnaise and pate, sanitizing equipment, etc.? Had the food business ignored EHO directions previously, or did the LG fail to identify this? I think there was a really big push 2-3 years ago when we had the big salmonella outbreaks, and regulatory guidelines has been communicated to the food businesses. But I think over time we kind of fell a little bit complacent after our cases did drop off. But in this instance, it was missed in the latest inspection. I mean, things change at food businesses all the time. But it was only until this outbreak occurred that it was found that they did not do proper acidification of that in-store made mayonnaise. But the point is that it was quite a unique outbreak in this instance because the actual source of contamination was actually not from the eggs, but from the equipment, which was most likely due to another ingredient other than eggs. But yeah, a really good point by James. One maybe key message that we can take away from this is that for local government to keep a finger on the pulse when it comes to store-made mayo, and do ask the question and do ensure that they do acidify their store-made mayo properly and verify that it is 4.2 pH and below, or even better still, ask them to switch to pasteurized mayo and save you guys a whole lot of headache, and also it's good for public health as well. So thanks for that, James.
Another question.
So I'll go to it again. So we do have another question. So it is from John. Where would a local government use confidence in measurement in risk profiling? So I'll just publish
that. John, would you mind just elaborating slightly on your question, please?
Yeah, while we're waiting for John to clarify his question, yeah, just would like to give a big thank you to all the local governments that have assisted in the outbreak investigations. We do have a few in a year, a lot less compared to last time. We do, I think at one stage we had 30 outbreaks a year, but this year we're taking really well, and eggs have really dropped out of the radar altogether. Yeah, just keep up the good work in terms of food safety assessment in your food premises, and do continue that education piece of your food businesses.
So thanks, John. I'll just publish the update to that. So in relation to port operators to increase the number of inspections, for example, or from previous prosecutions. So, I mean, for each sort of category there, you obviously have a range of frequency of inspections. So there is the ability there to increase inspection frequency. And again, this guide is not mandatory. So, EHOs have that flexibility and they should use their judgment when determining an appropriate inspection frequency. And there's also the requirement to, go and do follow-up inspections and so on if you're taking action for a poorly operating food business. So I don't know if that answers your question, John. And we have another question. Publish. Okay.
So we have another question by Sophia. So she asks, for your information, the food premises were requested to submit a food safety plan for mayo and pate several years ago after it was identified they were making in-house. Is there any plan for DOH to release some guidance around pate food safety? We did identify pate as one of the key risks for Campylobacter, and in this instance, it was used, chicken livers was used in this outbreak. That is in our long-term plan, definitely, because it's one of the high-risk food that we don't have much info on at the moment. But saying that based on the epidemiological data, we're not seeing that much Campylobacter infections in cases that has consumed pate. We did get a few, but predominantly is through the consumption of chicken meat. But saying that, point taken, Sophia, that pate is still a high-risk product. In this instance, with this food business, it was fully cooked to 180 degrees, but we cannot say that for all food businesses, and definitely that's worth to have to put out some guidance in that respect. Most probably for the Mayo guidance, we can be simplified further as well to a quick, sharp one-pager that can be provided to food businesses that still want to do it in-house. But definitely for pate, for thumbnail prevention and also CAMPy prevention, we would definitely look at providing some guidance for LGs to hand out to food businesses. Thanks for your comments, Sophia.
Okay, and Andy asks if there's a known reason why only 51% of enforcement agencies use the risk classification tool. So there was an additional 31% who advised that they use the risk tool, but they didn't, because the question was an open question, they weren't very specific. They didn't say the full name, WA risk tool. So I think it's highly likely that it's closer to 80% that is using the tool. Certainly we didn't have any feedback specifically in the comment sections on that.
Thanks, Shopna. Just a comment from her that New South Wales Food Authority has CAMPy in chicken liver document online. Yeah, we are aware of the Food Authority there has plenty of good resources, and we'll definitely get in touch with them in terms of borrowing their guidance and building further onto it. Thanks for that. We'll give it one more minute before we close off if there's no more questions. Okay. If not, yeah, feel free to reach out to us via food safety inbox. But once again, we on behalf of the food unit and also CDCD AusfoodNet, we'd like to thank everyone for your time in attending this webinar. If you have any topics that you're interested in, feel free to reach out to us or the EH Stakeholder Engagement Officer. We will try our best to accommodate your needs and come up with useful webinars that will help you in your work. So with that, we thank you for your time and have a good day.
Thank you.
Thanks, everyone.